Hello, I'm Dr. John Fielder, co-founder and chief executive of African Mission Healthcare. I know that all of you are feeling the impact of COVID-19 and the uncertainty of what may come next. In Africa, we're experiencing the calm before the storm. I want to share briefly my early perspectives of what's happening here in Kenya and across the many mission hospitals and communities AMH serves. I worry that the effects of the virus in Africa may be quite severe in spite of efforts to reduce its transmission. While African nations were quick to limit travel and institute proactive control measures, other factors are likely to facilitate the spread of COVID-19. Most people have limited access to water and soap for hand washing. Many live hand to mouth. If they don't work, they don't eat. Crowded living conditions are the norm. HIV, lung damage from tuberculosis, and malnutrition will likely all contribute to severe COVID disease. Countries like the United States are struggling to respond to the virus. How much more difficult will it be for Africa? I anticipate substantial shortages of personal protective equipment for health workers, oxygen, and medicines. The already limited health workforce is likely to become rapidly exhausted. While this scenario may sound familiar, I fear it may be far, far worse here than in many other parts of the world. The capacity and reserve of African health systems is only a small fraction of that in the West. Despite these obstacles, I also believe that our mission hospital partners will play a positive role in responding to the coronavirus pandemic. AMH's mission is to strengthen mission hospitals to aid those in greatest need. Their capacity to deal with crises has been built up over many years. We have witnessed the outstanding response to the AIDS epidemic. AMH is privileged to be part of this strengthening for such a time as this. I'm currently speaking to you from my home an hour outside Nairobi, where I will join the COVID clinical team when cases start coming to Kijabe Hospital. I also helped establish Kijabe's first intensive care unit 15 years ago. Thanks to years of effort by Kenyan and missionary health professionals and with the support of people like you, Kijabe is now a mission teaching hospital that offers a wide range of life-saving services and has also developed a strong COVID-19 plan. Yet I remain deeply concerned that our hospital partners, including Kijabe, may be overwhelmed by this crisis. They'll be challenged to treat COVID patients and other emergencies while facing enormous pressures to keep the lights on and the hospital running. At the very time the hospitals are most needed, the crisis will severely impair cash flow from routine services. We need for each hospital to survive and thrive for the current crisis and the next one. I've learned from living in Kenya and Malawi that the people are hopeful and extremely brave. AMH and people like you have an important role to play in coming alongside them. I encourage you to lift Africa, its leaders, its health workers, and its people up in prayer. Please continue your support for AMH and our ongoing capacity building programs. Our hospital partners are essential to the region's response to COVID and will be here far beyond the pandemic. And if you're able, please get involved in the fight against COVID-19 by providing additional support. With your help, we can increase assistance to our partners and their patients during this crisis. Thank you for your time and concern. God bless and stay safe.